Vibrant little Sadie Rutenberg was the first patient to ever receive a pediatric heart valve 3 years ago. It was part of a clinical trial for patients 5 years old or younger with a diseased, damaged, or malfunctioning heart valve. Leo Rutenberg and his wife always knew their baby girl would be born with heart problems that proved to be more complex than they thought.
Yeah, when we brought her home from the hospital, she was feeding, but she was feeding all the time, 24 hours a day basically, but she wasn't putting on any weight. She ended up being a fussy baby. She wasn't sleeping very well. She was sweating doing just the most simplest things like eating. She was sweating and her skin didn't look very good. It was mottled, and we knew something was wrong. And about 2 months after we brought her home from the hospital after her birth, we realized she was in a bad way.
Dr. Jonathan Chen is the doctor who performed Sadie's surgery, the co-director of the Seattle Children's Hospital Heart Center, and division chief for pediatric cardiothoracic surgery. Dr. Chen tells us the FDA recently approved Abbott's mechanical heart valve, the world's smallest and only mechanical heart valve designed for newborns and infants in need of a mitral or aortic valve replacement.
For kids, what that means is in the past, when the 15 millimeter valve was available to us, it would take several days for us to get it because it would have to go through this process with the Institutional Review Board, and then you have to get the valve from the company. Now on the shelf, we can use it right there in the operating room. So obviously for emergency operations, the valve was never available to us before.
According to Dr. Chen, the impact of this technology will be profound. Before the valve was available, there were no other alternatives.
Your alternative was either to stay in the ICU on a ventilator, on medications, asleep for weeks to months sometimes before you're big enough to accept an adult prosthesis, or we were talking about other alternatives like palliative care or heart transplant sometimes. All infants and children should be candidates for this as long as their mitral valve annulus, as we say, or the diameter of the valve, is close to 15 millimeters. The impact of having a prosthetic mitral valve that will then replace a valve that's either very leaky or very narrow is profound. I mean, you will take a child who's on a ventilator, on multiple medications in the ICU, do the operation where you give them, as we say, mitral competence, and then within days they are off the ventilator, feeding and growing, and back to being sort of a happy, healthy baby.
Healthy like Sadie, this miraculous medical journey has continued to amaze her father.
She's such a firecracker. You wouldn't believe she's been through what she's been through. She loves to do all the things that a 3-year-old you would expect would love to do, going to the playground, going to the zoo and seeing the penguins and giraffes. And after she got the Abbott valve, she just took off. I mean, she's a different child, and she's growing and keeping her parents on their toes for sure.
Our expectation is that they will outgrow the valve. We want them to outgrow the valve because that means that the operation has been a success. So all these kids will need another operation, or probably 2 or 3 in the future. The prognosis is great because once they're out of the woods with that first feeding, growing, the first valve operation, the subsequent valve upsizing operations are pretty simple and relatively short and low risks.
Also, Dr. Chen reveals a vast support network for children and families to deal with congenital heart disease. Learn more by visiting Abbott.com. Bringing you the best of California, I'm Gigi Copes for California Life HD.